I think the thing I want to get out there, first of all, is obviously we've seen a lot of tweets from the president about the Freedom Caucus lately. In fact, he called out a couple of members just yesterday or maybe earlier today. Didn't mention you, but he did say that the Freedom Caucus is something we need to fight in the coming years, as well as the Democrats. As a member, how do you take that?
Oh, I take it with a grain of salt. I think he's lashing out. Maybe he's being a bit of a bully. I'm not sure, but I kind of laugh it off. He's probably frustrated, and it's like the big problem with this bill. Well, there's lots of problems with the bill, but the process is one of them. Mm-hmm. If you recall, 3 weeks ago, is a secret document. It was stored in a secret location. Senator Rand Paul was going around the Capitol with a copy machine looking for it, and then they laid it upon us, and they said there'll be 0 hearings on the bill. That's not good government. And then you're going to have 0 opportunities to offer amendments to the bill. That's even worse government. Mm-hmm. And then they said 18 days after they gave it to us, we're going to have a vote. And we're talking about health care. We're talking about 1/6 of our economy. We're talking about people's lives. 18 days and no hearings and no amendments? That's bad process, as far as I'm concerned. I'm glad that the Freedom Caucus and a lot of moderates in our party, the Tuesday group, are standing up saying, no, what we need to do is take a time out. I told the president and I tell our leadership, folks in Iowa, they don't care if it's done Thursday. They want it done right. And this bill is better than Obamacare, but it's not what it could be. And the biggest thing that drives me is, are we taking care of people that need help in the new bill? Yes. They're being taken care of with Obamacare. They're going to be taken care of with the new bill. I'm concerned about the 180 million Americans that get their health insurance through the group plans, through their employers. And this bill, as I understand it, is not going to bring down their health insurance premiums. And I believe we can do that if we implement some of these free market reforms. Wouldn't it be wonderful if we could bring down every worker in this country's health insurance premiums by 20% next year? And the bill as proposed, we keep digging, trying to find numbers on it, which isn't easy, but the bill is proposed. Insurance premiums are going to go up. They're going to go up at an additional 10 to 15% higher than what Obamacare was going to go up over the next 2 to 3 years. That's not what we're looking for. I want to get people's health insurance costs reduced, their out-of-pocket reduced, the deductibles reduced. I believe we can do that.